According to the Health Minister, Dr. Motsoaledi, more than 500,000 people have been newly initiated on antiretroviral treatment in just under 6 months. While the figure signals possible progress then in the fight against HIV, it has also raised a few eyebrows among health experts who are questioning the accuracy and sustainability of such rapid growth. For more on this, we're joined by the chairperson of the Treatment Action Campaign, Sibongile Tshabalala-Madhlala. Thank you so much for joining us then, Sibongile. Let's just get a clear sense of what it is that you're questioning then as the Treatment Action Campaign. Is it the number or the rapidness of that growth in itself? Do you believe that there's perhaps a few inaccuracies?
Arabile, let me start by correcting this. This open letter, I wrote it as an HIV activist, as a person living openly with HIV.
Yeah.
And what we are questioning here are the numbers. Exactly, because numbers and data is very important to have accurate numbers so that we can be able to see or measure our progress in the fight that in the work that we are doing. So when the minister in February gives us the same number, and that number he was giving it, we were launching 1.1 million people closing the gap, and that 1.1 million close gap campaign, it was a campaign launched to bring back those people who were missing into care. And then 6 months later, he says we have made progress and states the very with our minds. And no HIV, and at a stage where we are as a country, we can't afford any chance of being misled with numbers, and you state it as a fact. So that is what we are questioning, to say you cannot say you are doing something and you say it's a fact while you are stating same numbers in the past 6 months. We want to know how many people from that 1.1 that are missing into care through this campaign up to now, how many people are back on care, how many people are retained on care, and how many people are we as a country expecting to put them on care? Because remember, we still have more than 2 million people who are not on antiretroviral treatment. So we are questioning the numbers, we are questioning the stats that the minister is giving it out publicly, and we cannot have set also.
Yeah, I'm going to try and take a step back, if you'll allow me, Sibongile, because I'm actually trying to understand this a little bit better. So, am I correct in saying then that the minister in February said that the number of people on HIV treatment is 5.9 million, and yet on the 15th of May, the minister also said that the number of people on antiretroviral or HIV treatment ultimately is also 5.9 million, and yet in the same speech, he then said in the Close the Gap campaign, there are at least 520,000 people that have been initiated on HIV treatment, which then means that if you've got the same number for the 6 months, that 520,000 doesn't actually exist. Is that the accuracy that you're talking about, correct?
Exactly, that's what we are talking about. You cannot, if you add 527 to 5.9 million, we're supposed to look at 6 million and a couple of numbers. I'm not good at math, but this is it's a pure mislead that the minister is giving us on public. You cannot say I've done this and this is what I've achieved while you have the same numbers in between the 6 months, and you're counting the same numbers and you say this is what we have done. That is not true. So that is what we are questioning, to say, Minister, give us the accurate numbers of how many people are on ARVs, how many people the 1.1 campaign gap has reached and put into care. Because also there's a difference in reaching people and keeping people and taking these people back into care and putting them back in care. Because you can reach 1,000 people, but if out of that 1,000 people, you have 2 people that are in care, you need to state that I've managed to reach this number of people, but this is the number of people that are in care. We don't care of how many people we are talking about, but what we care about is the number who are on of people who are on treatment, so that we can be able to use treatment as prevention to reduce the HIV infections in the country.
Yeah, and this is all important because the drive is to trying to get, 7 million, I believe, then. Do we know by when they intend to reach 7 million people with regards to HIV treatment?
According to their state, by 2030, we were supposed to have that. But surprising, Arabile, with all that is happening, with all the funding cuts and the instability that is happening, we are not sure as activists to say we will reach those numbers by 2030. And when we are looking at other scientists and projections, it shows that instead of us reducing the numbers of people living with HIV or being infected with HIV, of people who will be in care, by 2030 will be in more serious situation than what we are. And that's what makes us not to be uneasy with the ignorance and the slow pace that the Department of Health is moving. It's not like we just want to pick a fight, but it's because we know how is it. As I'm saying, I'm openly living with HIV. I was diagnosed in 2000. I know how to live with HIV without treatment. I suffered all the HIV-related illnesses. I don't want anyone or myself to go back to that situation. And we cannot win all this and have so much improvement. At the end of the day, we want to go back to where we are. We cannot afford that, and we're not going to allow that as activists.
And it's going to get a lot harder without the funding then for PEPFAR.
If there is no funding for PEPFAR, then our government must take responsibility. Our constitution says our government must make means with the limited resources. And what we are asking for is to say, what do you have on the table? How can we work together, you government and civil society, clinicians and scientists, to say we work together, we find better ways of fighting HIV. We are not saying just do it alone, go there, do this, but we want to come on the table. We want to find solutions together with the minister. That's all we are asking for.
In doing so, has the minister or the minister's office or anybody in relation to the health department been able to assist in saying this is when we'll give you that answer, or given you any kind of clarification? I'm assuming not yet.
Unfortunately, Arabile, we don't have specific answers. On during the week, I think on Thursday afternoon, we had a meeting with the Health Portfolio Committee where we were stating our case, and they were telling us what the minister has told them. But out of that meeting, there is nothing concrete that we can talk about to say this is the plan. But at least the Health Portfolio Committee is willing to speak to us and is willing to facilitate this process, of which we feel like it was supposed to be done long time ago. But as much as the chairperson of the Health Portfolio Committee is willing to work with us, we are hoping that also the minister will understand that this issue, it's not just an issue of single particular group. We need everyone who's working on HIV, the healthcare system, the government, all stakeholders to come together and come up with solutions and work together, because all the successes and achievements that we had in the country, no one can claim a victory and say, I did this alone. Yes, government played a huge role, but for government to play that role, it was for us, activists and people living with HIV, who went out on the street and give evidence to the government to say, you can do this, there is medication. We took our very own government to court in order for us to have ARVs. We don't want to take our government to court for us every time not to die. They need to do what they're supposed to do. It's their responsibility. But we are saying, let's work together as an HIV community or health community to address these issues, because we don't want to go back where we were in the 90s.
Sibongile, the Minister Motsoaledi, in that press briefing where he gave an ultimate tongue lashing, particularly to the media, said that activists are effectively lying because the US government funding, which is PEPFAR, only comprised of 17% of the country's HIV budget of 46 billion rand, which ultimately means that government has this all under control. So how do we believe, and who do we believe then in a situation like this? Sibongile, I'm not sure if you can hear me at all.
Arabile, honestly, the 17%, we don't dispute that. We understand that. Can you hear?
I've got you now. Just wanted to check
Arabile?
one more time to see because I think the connection may be a little bit bad. Just to
Yes,
check
I
one more
heard you.
time. Have you got me?
I heard you. I heard you. Can you hear me?
I've got you right now. So I don't know if you caught that question, just with regards to the minister then saying that activists are effectively lying because US government funding only comprised 17% of government's total funding of 46 billion.
Yes, he is right. It comprises of 17%, but that 17% was playing a huge role in the fight against HIV. The minister is denying something that he knows, that the 17% was addressing the issues of prevention, the issues of research that is done of new developments on HIV. The key populations were accessing treatment through that 17%. So that 17% was playing a huge role in terms of addressing our challenges that we have. And with that,
Okay. It does look like we have, unfortunately, lost connection there with Sibongile Tshabalala.